For decades, we've thought about health in Africa all wrong. We've seen it as a cost, right? A problem we just have to keep pouring money into. But what if that entire mindset is flawed? What if health isn't just a cost center, but the very foundation for a brand new financial infrastructure? All right, so let's get right into it. The biggest challenge facing the continent isn't a lack of effort. It's not about generosity. The real issue is the lack of integrated infrastructure. You know, the kind of system that can take the simple act of getting care and turn it into real, tangible economic power. And that right there is the mission of AfriPharm Health, to build what we're calling Africa's health economy backbone. So, to really see the opportunity here, you first have to understand this huge paradox, something that's right at the heart of the continent's economy. Get this, the World Bank says there are a staggering 350 million adults in sub-Saharan Africa who are financially excluded. I mean, think about what that really means. No formal credit profile, no underwriting history, basically no real access to the formal economy. To the system, they're invisible. But what if that invisibility is just an illusion? What if those millions of people already have a rich, structured history that proves just how reliable they are? A history that's just been completely overlooked until now. Well, that history, it's their health behavior. I mean, just think about it for a second. We're talking about years of pharmacy purchases, consistently sticking to chronic medication, keeping vaccination records for their kids, treatment logs, all of it. This isn't just healthcare data. It's a detailed, verifiable record of responsibility, of reliability. It is literally a financial identity just waiting to be unlocked. So you have to ask, why hasn't this incredibly powerful asset ever been used? Well, the answer comes down to one big problem, a long, long legacy of fragmentation. You know, for decades, aid has built clinics, it's delivered vaccines, and that's all great stuff. But it also created these totally separate, siloed, paper-based systems. And the result? The World Health Organization estimates that a shocking 20 to 40% of all health spending in some places is just gone, lost to inefficiency and broken systems. And that really gets to the core of it, right? Billions of dollars have been spent, but without a modern, integrated digital infrastructure, the system just leaks. It leaks value, it leaks trust, and it leaks transparency. The problem was never about a lack of effort. It was about the lack of integrity in the infrastructure itself. Okay, so this is where the opportunity for a massive reframe comes in. We have to change the entire conversation. Think about it. Every single consistent health action, picking up a prescription, getting a vaccination on time, that's all behavioral data. It's proof of reliability. So in this new world, health becomes trust. And we all know that in any economy, verifiable trust is the absolute key to financial access. That trust, it can be priced, it can be underwritten, and it can open doors that have always been locked shut. Trust becomes economic power. And finally, your own health history, your own responsible behavior, it becomes a totally new form of collateral, a real asset that you can leverage. Now, I know this might sound a little abstract, but the way it's applied is incredibly practical and really human-centric. So let's take a look at how this actually works on the ground. So, let's take a farmer in rural Zambia. For 2 years straight, he consistently picks up his diabetes medication. Now, this record, which he consents to share, is geo-verified. That just means his location and identity can be confirmed, which proves he's stable. A microinsurer looks at this data and doesn't just see a health risk. No, they see proof of reliability. And because of that, they can offer him lower premiums and maybe even access to microcredit to invest in his farm. Or how about a market trader in Accra? She pays for her microinsurance using mobile money, something millions of people already do. Then, if she has to go to the hospital, the claim gets validated, automatically. And the hospital? They get paid in days, not months, thanks to a stablecoin settlement. That speed, that's what builds trust, and it's that trust that builds the entire market. These individual stories are incredibly powerful, right? But they're really just the beginning. The bigger vision here is to scale this up and build a brand new piece of continental infrastructure, the health economy. And how does AfriPharm Health do this? By finally integrating all those fragmented pieces we talked about. We're talking about the pharmacy partner network, the hospital partner network, the emergency responders, home care providers, and virtual care platforms. All of them unified into a single network that operates on consent. What this creates is a complete economic graph of trust.
And here's the tech that makes it all possible. Look, this isn't just some big database. It's a true infrastructure layer where the mobile money systems people use every day connect with modern stablecoin rails. That means instant, transparent payments. Suddenly, healthcare isn't just about patient files anymore. It becomes the single most powerful, real-world use case for digital money in Africa.
So, this forces us to ask a totally new question. Africa doesn't just need another health app. What it needs is a true identity infrastructure that can convert human behavior into a powerful economic signal. Health is no longer just another sector. The real question we need to be asking is this: could it be Africa's next financial backbone?